Hi, this is Dr. Siegfried again, and thanks for coming to my website, or my YouTube channel. Today we're going to be talking about calcium and why any calcium that you take should be ionizable calcium. I want to talk about calcium just briefly because it has many, many uses in your body. And I'm going to focus on the practical uses of calcium that you can apply today in your health regimen. For example, typically we think of calcium making strong bones and teeth, which it does. But it's also helpful for relieving muscle cramps, fevers, flu, insomnia, allergies, and immune system problems. So I'll go over that as well. Now, calcium is the most consumed supplement in the United States, and it is one of the most important minerals known to man. And it is one we are most deficient in. Magnesium, by the way, is as well is calcium's helper, so to speak, in the body. But calcium has severe enemies, which keeps it from doing its job in your body. For example, fluoride. The chemical fluoride paralyzes your thyroid gland. And your thyroid gland helps with the calcium metabolism in your body. And fluoride is found in most water supplies, most commercial liquids, and other foods. One exception, for example, is Portland, Oregon, where the people just recently voted to not have fluoride in their water. It was a big campaign, and people decided that fluoridated water, they found out that they know that fluoridated water is no good for you, so they voted against it. So it's not in the water supply in Portland. But fluoride is in a lot of the other municipal water supplies. And there's a ton of research that demonstrates the problems with fluoride, but I'm not going to go into that. I'm just going to tell you that fluoride is a chemical that is an element that interferes with the use of calcium in your body. Another element that interferes with calcium use in your body is chlorine. That interferes with your normal intestinal flora so that you can't absorb calcium. Chlorine is also found in all city water systems. Chlorinated water is also one of the largest contributors to bowel cancer that we know of. Bromine is another enemy of calcium, and bromine is found in most commercial flours and most bread products, unless they're organic and non-GMO and that sort of thing, and it's in the form of methyl bromide. Methyl bromide is a central nervous system toxin, and that's why it's used in commercial flours. It kills bugs. So you can see how calcium is constantly under attack by other elements. And what you need to do is be aware that calcium, if you are taking it, you need to know how much, what kind, and it seems like all of my patients, in fact, you're probably taking calcium of some kind yourself. But the question is, what's the best kind of calcium? And as I said earlier, more calcium is consumed in the United States than any other supplement, and it is essential for your bones, your teeth, your heart, your nerves, and your immune system. As an essential mineral, we need it daily. Some need it more than others. For example, depending on your activity level. Now, if you're a heavy construction worker or if you're a competitive athlete, you need more of it. But if you're sedentary, you don't need as much. But we still all need a certain amount of calcium daily, and usually we're told we need about 1,200 milligrams. But there's more to it than that. And it has to be in the proper form or your body can't make use of it properly. So what is the best form, and why is it so hard to get it into your system? And why is the best form not readily available to you? Well, the problem is this. Before calcium supplementation, people were getting their calcium, traditionally that is, they would get their calcium from their foods in the mineral form, and the best form of it was raw dairy products, bones that were soaked on the stove by your grandparents perhaps, and also green leafy vegetables. But since the advent of the foods of commerce, which is white flour, white sugar, pasteurized milk, and things like that, we simply don't get enough calcium from our foods, and even most supplemental forms of calcium are not doing what they should be doing. And especially now that most dairy products are pasteurized, calcium is not only not available in your body, it is actually doing you more harm than good, according to the studies that have been done on this situation. So you need to get calcium in a supplemental form, unless you're using raw milk dairy products, that is. You need to get calcium in a supplemental form that's going to be that your body can make use of. And that form has to be ionizable calcium. Ionizable means that your calcium supplement is readily available for your body to absorb it. And this is a big problem because from a supplement standpoint, what you need to have, and most people don't have, is what's called calcium lactate and magnesium citrate in a 5-to-1 ratio for proper absorption and assimilation into your body. And this is according to the standard biochemistry textbooks. By the way, calcium lactate is not a dairy product, so people with problems with dairy are okay with it. But what are the basic indications for why you need calcium? Some of them are, I should say, why you need ionizable calcium, and some of them are fever, infections, cramps, hyperthyroidism, osteoporosis, canker sores, coughing, insomnia, pregnancy, infancy, relaxation, soft tissue injuries like muscle cramps or muscle pulls. In the clinic, I always recommend calcium lactate. There are very few companies that have this form of calcium, ionizable calcium, available to you, and that is available so that it doesn't stress your digestive system. And to check your calcium supplement at home to see if it is the right kind, you can simply take your bottle, look on the bottle, and see what the main ingredients are. If it reads calcium carbonate, it's not the best form because calcium carbonate is commonly put in a bottle as ground up oyster shell, and that's very difficult for you to digest. If it says calcium and magnesium, it should be calcium lactate, magnesium citrate, and it should read calcium, like I said, calcium lactate, magnesium citrate, and it should be in the form of a 5-to-1 ratio. Anything else is going to put an undue stress on your digestive system, and you may not get the benefits of the supplement. Finally, a lot of people are taking calcium with vitamin D3, and this is not good because vitamin D3 is synthetic, and it can actually cause kidney problems over time. So, and this was demonstrated by the Price-Pottinger studies. The Price-Pottinger Foundation has demonstrated this, records this in the studies of Drs. Price and Pottinger. So your calcium, to work properly, really needs to be ionizable, but you also need to have the vitamins A and F. Vitamin F is usually you hear about the omegas these days, and that's basically vitamin F. So for your calcium to work properly, it should be combined. You should be taking it with cod liver oil, which is the best source of vitamins A, F, and D, which are essential for your calcium to be absorbed properly into the body as well. The Price and Pottinger studies, again, have demonstrated this very conclusively. So I hope that's a fair summary for you regarding the importance of calcium and why you need to be taking calcium lactate along with magnesium citrate together in a 5-to-1 ratio, unless you're getting it from your raw milk dairy sources, which very few of us are. And if you're taking the calcium lactate, you need to be, it's also important to be taking cod liver oil, which is the best source of vitamins A, F, and D, which helps the calcium metabolism as well. And the cod liver oil that you should be taking should be a raw cod liver oil as well. So if you have any questions about this information, you can feel free to call me. You can go to my website and email me. I'm at the clinic in McMinnville in Portland, so or you can go to my website. Like I said, it's OregonWellnessCare.com. So please feel free to contact me if you have any questions, email or call, and our information is here on this video. So I look forward to hearing from you if you have any issues that you'd like to discuss with me regarding calcium. Thanks a lot, and I hope you'll continue to subscribe to my YouTube videos.